Well, thanks for coming, everybody. I have to tell you that I feel really, really honored to be here. And I was telling Jeff that it was very emotional for me to come through the doors at MAC, because MAC's the first church I ever went to when I moved to Missoula. And certain things happened in my life at that time, and I still go to the Alliance Church, but I go to Zootown Church now. Anyhow, when I first moved to Missoula, things weren't going according to my plan, and I was really mad that, God wasn't following my plan, and my life kind of fell apart. And you're probably wondering, what does that have to do with the foster care clinic? So we're going to get to that in just a minute. But so things were happening. I was a single mom, and I had 2 young kids. And so I went to work, and I had 3 jobs, and I decided that in Missoula, Montana, even having these 3 jobs and not being able to be there for my kids was really hard. So I decided during those 3 jobs that I would go back to school and I would go to graduate school. So that's how it kind of came about. I became a nurse practitioner. And in 2009, I just really felt this strong calling that I wanted to work in child abuse and neglect. And so I had been a pediatric nurse for 20 plus years, went back to graduate school, got my nurse practitioner degree, and I started working at a clinic called First Step Resource Center, which specializes in examining children and adults who are victims of sexual violence. So I started doing that work, and as I was doing that work, I got trained in how to interview kids, and I really felt like I had a gift for that, and I really felt like I was doing a great job doing this. But as you can imagine, doing this work day in and day out gets very stressful, and I just wanted to see some healthy kids again. And so one of the things that we did at First Step is we would do these kits called drug endangered child kits, and CPS would bring kids over and we would do hair or urine samples to see if they had been exposed to drugs. So that it was very few of those patients that we saw, but a lot of times these kids would come in and they were so neglected and they needed all these medical things, but we didn't do that at First Step. I didn't do primary care at First Step. I just did child abuse and neglect. So I'd call around and try to get them in to see somebody, get in with the primary care, and things would fall through the cracks. A lot of the kids that I interviewed who had, issues with child abuse, a lot of them are just interviewed. I would try to get them back to a primary care provider, and it was just so difficult. So one day I was talking to a good friend of mine, and she and I used to teach here. One of my 3 jobs was teaching at the university. So one of my friends that I taught with at the university became the director of the Missoula County Health Department. And she and I had this conversation, and I said, there's got to be a place where these kids can go and they can get their referrals until we figure out where were they seen before, because maybe they were seen at a clinic somewhere in Missoula, but I had no way of knowing that. And a lot of times if they came in with foster parents, the foster parents had no clue. CPS had no clue. So by the time we figured out that child X was seeing Dr. So-and-so, it was many months sometimes after the fact. So I said, wouldn't it be nice if we could have a clinic where a primary care provider would look at this kid, do a full exam, and refer them to places that they need to go, whether that's an eye doctor, whether that's a cardiologist. Some of the kids really had a lot of acute healthcare needs. And it was a lot of these kids that were brought in by CPS that we didn't know the history on. So Kate and I talked, and she said, well, a few years ago we had this program. It was a home visiting program by the public health nurse who used to visit certain populations of the foster care kids. So they had to be a certain age and whatnot, and they followed them. So that was a little bit better, because at least the public health nurse would then try to figure out which doctor they were associated with, if anybody, to get them back in. Even at that, if you know anything about primary care, if you've tried to get in to see your family doc lately, sometimes it can be very difficult, and an appointment can be 2 months out. And Most places have same-day appointments, but they're quick little 20-minute appointments for when you're sick. So anyhow, we started talking about this, and at the time, because I worked at First Step, sometimes I had some extra time on my hands, and I talked to the people in mission and leadership, because part of our mission is to serve the vulnerable and the poor. And I said, we really need to have this clinic where we see these kids and I can refer them to specialists and refer them to a primary care doc. So they said, okay. And then we started meeting. And it wasn't just Claire at the clinic with Providence, it was actually the county health department and CPS. So there was born the Missoula Foster Child Health Program. I myself just work at Grant Creek Family Medicine, and I help run what's called the Foster Care Clinic. So it's a tri-agency agreement between Missoula County Health Department, Child Protection Services, and Providence Health Care, which is really our little thing at Grant Creek Family Medicine. And the nice thing about Grant Creek Family Medicine is it's a medical home, so we are able to have same-day access and refer the kids out to where they need to go. So the Missoula County Health Department provides home nurse visiting program to the foster care kids and their families. So if you all have foster kids, then you've probably seen Judith or Jen come to your house, and they do assessments and that sort of thing. CPS, they assure that the appropriate referrals are made and that there's some good case management. We sometimes need their help to get those referrals and get kids to their appointments. A lot of times, you're all here and I'm sure you're very involved. Sometimes kids who are in foster care end up with kinship or family that are not quite so alert and able to get those needs met. So sometimes they need a little help from CPS and from the public health nurse. So you probably can't really see this very well, but in 2004 to 2009, there was a program called Follow the Child, and this is where the public health nurse would go and visit certain ones of these foster care kids. They were given a grant to do that, and then it died after that, and so there was really no money, and Judith, out of the goodness of her heart, Judith is a public health nurse, would still go see these kids because they were in such a vulnerable place. So she kept going to see those kids. So in December of 2010 is when Kate and I met, and we called CPS, we called the powers that be at Providence and said, we want to start a clinic. So we decided to start this clinic with the CPS Region 5, which is Missoula County, and we started to come up with a program, and it needed a lot of legalities. So we had the county attorney's office involved as well so that they could look over all the legal stuff so that we could get medical records, share medical records without any issues from anybody. In November of 2011, the health department applied for a grant and they got the grant. So all these things were sort of falling into place because remember, they had no money to have the home visiting nurse anymore. So all of a sudden they got a grant. So then we told Providence, we've got to do this. We've got to get this foster care clinic up and going. So in May of 2012, we started what was called the Foster Care Clinic and the Missoula County Foster Child Health Program. Just to give you some statistics about kids in foster care, there's been a 75% increase of children that are placed in care since 2008. The Missoula Foster Care Clinic provides a primary care provider within the medical home if they don't have a primary care provider. If they have a primary care provider, if we know that little Johnny saw Dr. X, the goal is to have them back seeing Dr. X. What Foster Care Clinic does is, as a primary care provider myself, you develop a relationship with your patient and you develop a relationship with the parent. And you don't want to be the bad guy. So sometimes at the foster care clinic, if I write down that they've been neglected, that I think their bruises are related to X, Y, or Z, and I'm worried about the parents, I'm the bad guy. They get to go back to their doctor and still have that relationship if they have a relationship with their family dog. So the access to care is totally compounded by the fact that these kids get multiple placements. The average child who's in foster care gets 3 placements per year. Yeah.
Are those statistics Montana or national?
These are Missoula statistics. These are just Missoula County. So over here, this is the number of Missoula County children in care, and I haven't updated this. This was as of September of 2015. So you can see the trend, how it's just really going up. So we had 132 back in 2011. I believe there's over 300 now in care in Missoula County. So foster care clinic, the foster child health programs, it's really a team approach, and that's what works well. It's nothing that I do at the clinic that's really all that special. We have the home visiting nurse and we have CPS, but what we do as a team is really a great, great thing. So part of what we do, I'll just give you some of the ideas. The collaboration is really the heart of what we do. We have such a strong relationship with CPS. I know all the caseworkers, they all know me. I know the public health nurses. If there's ever any issues, we call each other, we get stuff done. With regards to training and the type of exam that they have at the foster care clinic, it's basically just a general well child check, and most of you have been through there, so you know that. A lot of times there's other issues, so we also do the drug endangered child kits, and we send those off to the crime lab, sometimes with lice jumping off the hair. I always wonder what they're going to do at the crime lab when they open this thing and these bugs jump out. So anyhow, we do those. We take photos if we need to, and we try. The goal, we've been really short-staffed lately, so it's really difficult, but the gold standard of what we would like to see happen at the foster care clinic is child gets removed, there's a referral. The referral automatically goes to public health and to us at the same time. The minute we get that referral, because we have this agreement in place, we get their medical records from wherever they've been seen before, if we know of anywhere that they've been seen. Now in the world of electronic medical records, that's a little bit better. So we try to get all their records prior to the appointment. Once they come in, they're usually there for about an hour and a half. And the goal is that we get all their issues looked at, and they get referred to whatever specialists they need, including a primary care provider if that's what they need. Really, we want it to happen within 72 hours of removal, but right now we just don't have that access. However, if CPS calls and they're really worried about a kid and they call me, it doesn't matter what I'm doing, I will see that kid. I will come in on my day off, I will see that kid, and we'll get it done. Ideally, we want all their appointments to be made before they hit the outside door, so that everything's all in place. And then we send a copy of our note to their primary care provider if they have one. We also send it to the public health nurse, and then the public health nurse follows up with the patients and the foster parents to say, hey, you were referred to the cardiology clinic, did you go? That way, when a child changes placement from one home to another, we still have some consistency to ensure that their care happens. We also provide same-day appointments for the foster care kids. So if the foster care parent calls, we try as much as possible to accommodate you, unless we are busting at the seams, which we have been lately, I'm sorry to say. This is just the numbers from our foster care clinics so far. So these numbers were up to, I think, 153 in 2015. We project we're going to see 170 kids in the clinic this year that we have served. These are actual patients seen, so we get a lot more referrals, but for whatever reason, maybe they've moved out of county, they no-showed for whatever reason, then we don't see them. The other thing is that I think we do a pretty good job at the Missoula Foster Care Clinic, so people from other counties are calling saying, can we send our kid there to be examined? I'm really, really worried about this kid. So they will send them to the foster care clinic even though they're not in Missoula County. The average amount of referrals that a child needs to a specialist is 3 to 5 per kid. What that is telling us is that the acuity, the the amount of medical needs of the children going into foster care is really climbing. So it's not unusual for us. I think it was 72% of all the kids entering foster care had a chronic illness. So they had something bad going on. A lot of times, I can't even tell you how many times I've seen children come into foster care and they're maybe 3, 4, 5 years old, and they have syndromes of things that should have been picked up really early on, and maybe it had been picked up but it was never followed up. So we try really hard to get those kids into specialists, and sometimes that entails out-of-town visits as well. Community hospital has a really, really good specialty clinic that we use a lot as well, where they see cystic fibrosis kids, those types of things. There's an average of about 8 diagnoses per child that comes in. And when I say 8 diagnoses, I'm not talking cough, fever, bronchitis. I'm talking 8 really big different things that are going on. So what does foster care clinic and Missoula foster care child health consist of? We meet at the health department. They meet weekly to talk about the foster care kids. I don't meet with them weekly. I meet monthly. We have a tri-agency meeting where we have a coordination conference. Quarterly, we also have a meeting with the higher ups. So we have the people like Sarah Corbally, who represents Child Protection Services in Helena, comes to these meetings. All the directors come to these meetings. We do quarterly reporting on the 4 goals, and if you have seen the CHIP, it's called the Community Health Improvement Plan for Missoula County, you will see that the foster care clinic and the Follow the Child program is there. If you saw the article about 2 months ago that the governor proposed Healthy Foster Care Kids Initiative. So the Follow the Child program, the Missoula Foster Care program, is in that initiative as well. Some of the things that we establish concrete goals on is that we want the kids to have a medical and dental home for all the kids in foster care. And that's not necessarily Grant Creek, that's wherever they decide to go. All their medical records are collected, they're reviewed, and they're summarized by the public health nurse so that when they go from placement to placement, when you take a child into foster care, you have a little bit of an idea of what's going on with them medically. They try to provide a really good comprehensive care plan, and then definitely a lot of involvement in education for the foster care families. Right now, it's a really exciting time for the foster care program because the KC Family Foundation, which is a national, really reputable foundation that looks after the child health, has given us a grant of, I think, $50,000. And there's somebody at the university right now, and I'm so glad it's not me, who has to look at numbers and data. So they are collecting data on our foster child health program, and they've published 3 papers so far, and people from all over the United States, the American Academy of Pediatrics called the researcher at the university and said, what you guys are doing is phenomenal, and we need to come up with some guidelines, and we need to replicate this. We need to do this everywhere. So, the other things that I kind of do on the side to be really aware of what goes on with CPS is I serve on one of the foster care review boards. The public health nurses do other ones. So there's 4 Missoula County judges, and there's one of us that sits on each one of those committees so we can kind of know what's going on with all the foster care kids. The foster care review, if you've ever been, and if you haven't been, you will be, is where you go and there's a panel of community members, and these are mostly retired social workers or medical providers, somebody who has some knowledge of foster care. And we listen to the families, the biological family, the foster families, the caseworkers, the attorneys, everybody shows up. And then the committee listens to all of that, and we make a recommendation to the district judge as to what should be happening with these foster care kids. So I talked about the deck kits, support group information, such as this group here. We try to provide all our foster care parents with that. And we try to do a lot of care coordination and transition of care with community facilities. So this is just a couple of things, a couple of papers that have been written. And now we're collaborating with Denver and other Montana counties. We're also collaborating with a university in New York, one in Wisconsin, Texas, and South Carolina, so that we can do the same thing over there. And that's just my little saying is, if we don't stand up for children, then we don't stand for much. And I really believe this. So to bring this full circle, when I moved to Missoula, Montana, I had no idea that I would ever go to graduate school. I just wanted to be a mom and just live a happy, quiet little life. And my life has changed in so many ways. And I am so grateful for the opportunity to do the work that I do. But mostly, I'm so grateful for all of you amazing, amazing foster parents who have stepped up to the plate. And I can tell you, we are looking at outcomes, and we are making a huge, huge difference in the lives of these kids. So anyhow, I'm happy to answer any questions you might have. If you haven't been to foster care clinic, then there's a glitch. The fax didn't come through or something. So you should be coming through. Anytime a child gets change placements, they're probably supposed to come to foster care clinic, but sometimes we sort of let that go. So anyhow, that's it.
Thank you.
Yeah. You're welcome. Anyone have any questions? Yeah.
Now, I know the records follow the one child, but what about sibling groups where they might have been raised in different homes? Is it still tracked?
Yes and no. So the answer to that is, if the children whom have been removed, those kids get seen at the foster care clinic and those records follow the kid. If the kid hasn't been removed, they've been somewhere else or something like that, then we don't track those records. We try to get a good family history. Another thing we're looking at is something called their ACE scores. If you've heard anything about that, is to try to figure out the level of trauma that these children have been through. I will say that, you know, in my career, you get to have a pretty tough skin when you work with some of these kids, and there's a couple of times where I've been brought to tears, but mostly tears of happiness because we've seen their lives flip and they finally get a chance to thrive in a good environment.
Who does the ACE score?
So we are not doing the ACE scores just yet. We're trying to collect some of that data, because the problem with doing the ACE scores, we have a social worker in our office right now, a social work intern. There's a lot of questions, like for example, one of the questions that has to be asked of the ACE score is, have you ever had a parent who's been incarcerated? Well, sometimes we don't have that history, so it's difficult to come up with the accurate numbers. So we're trying to figure that out right now. But we really want to keep track of that, because we want to know exactly how. We know that their ACE scores are high. So the ACE score is a level of trauma. So we know that any kid who's in foster care, their ACE score is probably pretty high. But exactly how high is what we don't know. So that's what we're going to try to do. Yeah.
Are you going to try to bring somebody else on because you are so busy?
Yeah, so right now the foster care clinic is myself and Dr. Venata. So Dr. Venata now, because we're really committed to this, we are so committed to this that Dr. Venata comes in on her day off to see foster care kids, because we don't want to let them slip through the cracks. There's definitely a lot of pressure right now, as you can imagine. As much as Providence is, you know, a great mission, and the Sisters of Providence and all that, it's still a business. And so when they look at numbers and how much money we bring in, we don't bring in any money. You know, we're in a hole with this clinic, but it is part of our mission, and it's something that we're really determined to keep alive. So now there's 2 of us doing that. We don't want to have too many people doing it, only because what happens is it's pretty specialized. We want people to be specialized in child abuse and neglect, and we don't want to dilute the volume, because when you dilute the volume, so if I only see, say, 10 kids a year, I'm not going to be as competent as at looking for those things. So my background, I'm very fortunate that I had all this background in education and child abuse and neglect, and Dr. Venata has some, and she's going again for another week conference just on child abuse and neglect. So there's another pediatrician starting in January, and the hope is that maybe she'll be able to help, but we probably don't want it to be more than 3 people.
It's kind of frustrating. I have a medically fragile child who gets sick pretty quick. And it's kind of frustrating when I can't get in for 2 or 3 days. If I win, we're probably going to be at the hospital.
Yeah.
Which is really hard when you have 5 other kids at home in another county, but they're all Missoula kids.
Mm-hmm. Yeah, it's been, our clinic has been really, really stretched in ways that are beyond imaginable. I have so much respect for our nurses, not just because Lisa's here, but our front staff. We are undergoing construction. The morale is low. We have lost 2 really amazing family docs that were doing such an amazing job and have 2,000 patients apiece. And so we're really struggling because all those 2,000 patients now are wanting to get in to see somebody. So we're getting them in because they don't have somebody else. And as you know, anybody in Missoula, it's really hard to get into. And we're encouraging them to go elsewhere, which from a business perspective makes no sense, right? But we're at the point now where I'm really determined, and Dr. Venata's really determined, that we're really going to fight really hard to try to keep the foster care clinic and keep the access for the foster care clinic, because it's really, really important work. Yeah.
So when there's a mother whose child has been removed and she's pregnant, with St. Pat's not having a maternity program, what do the nurses do?
They do.
What do the nurses look for, when that mother has another baby, whether they keep that baby or not?
So I think those decisions, until the baby is born, I think there's some very strict laws with regards to removal and observation. A lot of times the person who's following the pregnancy, so the OB-GYN or the family doc who's following the pregnancy, will alert CPS if they're suspicious. So what I've seen happen in the past is if they have a suspicion of drug use, for example, then when the baby is born, they'll do some drug testing, and if the baby tests positive, they will put the baby in foster care. But until that happens, it's kind of a slippery slope as to how much control CPS. They really don't have control, unfortunately, over an unborn child, which sadly. Yeah.
There is a screener that happens at the hospital.
Yes.
By the social worker.
Right.
That if they score so many points on that screener post-delivery, that they're assigned a $10.
Yeah.
But they can't.
Yeah.
In an attempt to sort of track that up.
Right. So if we don't have anything concrete where we remove the child right away, they're still followed with the public health nurse.
Claire, do you have maybe advice for these families with the healthcare of their kiddos, or maybe certain trends that you see across the board, or just I don't know, any advice on that end?
I think one of the most important things I would say is to ensure that these kids are, followed, and if they happen to be in your care for a while and then they go to a different foster, a lot of times what happens is they will go into a foster family and then they find a family member, somebody to take care of them, so they'll switch placements. So probably the most important thing I would say is, just out of the goodness of your heart, just write down if they have any upcoming appointments, give them my phone number so that stuff can be followed up, and if you can, get their information. We can usually get that from CPS. but just the exchange of information is really, really important. But the other thing I would say is rely on each other. Like, these support groups are great and you're not alone, and it's really, really hard. This is hard work. And as much as you guys might look at me and say, boy, I could never interview kids who have been sexually abused, I look at you and I think, I don't know that I could take in all these kids into my home and disrupt my life and all this stuff. So, you know, everybody has their own little thing that we try to do to make, you know, these kids' lives a little bit better, but it's appreciated. Yeah.
What about all of the kids that are being removed from meth-related issues right now?
So there's a lot of that. There was some statistics in the newspaper not that long ago about meth use, and it's definitely a growing problem, which is worrisome. One of the reasons why we can see that it's a growing problem is we do these drug endangered child kits, and this is how sad it was the other day. They do the reports in batches, the crime lab does, because they send it to somewhere out of state. And I got these reports back, and I got 6 of them back that day, and I was really happy because one of them was negative.
So what about the stuff? So we have this problem, right? Like, we feed kids and then we're like, I don't want the stuff. Like, it's hard to make a decision when you know that mom spent missing for 3 months, you know, dealing and using meth in another state. I get the kids back and like their blankets are in there, right? Like,
Yeah.
let alone the other creatures that are, you know, diving around in there. And so that's always been hard for us to make that decision. We lived in the garage for a while. Just leave it. And then
Yeah, and if you're concerned of any type of ingestion, make sure you just call us, because here's the thing about the drug endangered child kits is the hair samples we can detect up to 6 months. Now, this is not something, you know, that you could take to court and say, oh, well, they were exposed to drugs, because there's defense attorneys will tear that apart. They'll say, well, it was when they were with the babysitter, it wasn't when they were with me. But the urine really shows ingestion, but it has to be done within 48 hours. When we do the drug endangered child kits, though, they divide it into metabolites, and you can actually see on the report if it was exposure versus ingestion. Now, the problem with meth and having meth labs is they cook it in their homes, and the sediments are all over the tables and everything else. So it's not necessarily that they gave the kid meth, but when they come back, there's enough metabolites in there that show that it was actual ingestion, so the kid touching the tables and that sort of thing. The statistics that you saw, which I don't even remember how much it was, because I just thought, well, those aren't right. Because a lot of kids, so for example, if a child doesn't have enough hair, we can't take their hair. If a child has any type of Native American background, we do not cut their hair unless we have the parents' permission. So that's quite a few kids between the ones who don't have hair and the Native American kids. So our statistics are sort of lagging. I would say that the percentage is probably a lot higher, unfortunately, than what you saw in the newspaper not that long ago, which I think it was like 30-some% of kids.
I saw an article the other day that said that Montana CPS is being investigated because one household in 27 had their kids taken away. And I explained to her, I said, well, the meth problem's bad. And in some areas, whereas I know Lake County is so overwhelmed that the doctors are changing birth records at the hospital so that the kids can go home because they have no.
One of the issues that we have everywhere is CPS. They are, you know, with the governor's initiative, I think they're hiring 33 more CPS workers. On the days where I get really, really discouraged at my job and I think I'm overworked, I'm underpaid, I'm just unhappy and I'm going to break down, I think of the CPS social workers and I think, you know, your life's not that bad, Claire. Your life's really not that bad. The CPS workers, and I would say, if I have a message for you, out of the goodness of your hearts, I know you'll call your CPS worker. They may not get back to you. Some of them are better than others. A lot of times, you find out, oh, your CPS worker moved to Mexico, or, you know, now you have a new worker, and that happens all the time. But please be patient because they are so overworked, and we try really, really hard. And I will tell you, I've been to court a lot. I've had the 15 minutes of fame that I did not want to have. And it's really difficult to be in those situations. But, you know, I have some confidence and I have the training, and I think I do okay in those situations. Those CPS workers, when they're in those situations, they get torn apart in a way. And I don't know why that on the scale I would be treated better by a defense attorney than a CPS worker. I don't know why that is, by virtue of doing something medical, I guess. I don't know. But they are so stressed and they have so much work. When they remove a child, their pile of paperwork is literally that thick. And so when we meet at our tri-agency meetings and I say, it would be really helpful if the social worker could do this and send me this, and they look at me like, really, you want us to do one more thing? And you can't blame them. So my message to you would be patient. They are working so, so hard. They're gravely underpaid for the work they do. And they really do have the child's best interest at heart. And although a lot of people would not say that. And you can imagine, they're on call at night. They sometimes have to go somewhere in the middle of the night, and this is Montana. You don't know what's going to happen when you show up at a house at 2 o'clock in the morning. So they are very brave, and we need to really pray for them that they're in a good spot, because they're working really, really hard. Yeah.
You're talking about meth use. Is it heroin use here in Montana? Because I've read that it's getting really outrageous in other places. Is it here also?
There's definitely some. I would say that when I, just from my own, and this is not, you know, don't quote me on this and put this in the newspaper, but I would tell you from the stuff that I see coming on my desk, it's mostly meth, marijuana. There's, in breastfed babies, there's a lot of prescription opiate use. Heroin I've seen a few times, but not frequently. Certainly not the issue that we have with meth.
The other stuff.
And prescription drugs is the worst. The second reading is on the whole thing.
Yeah. And the only nice thing, I shouldn't say nice, but that sounds really awful. But the thing about prescription drugs is at least the kids are not exposed by environmental hazards if they're breastfed, or, you know, obviously the behavior of the parents will have them suffer.
Here in Missoula, will they pull a baby if there's marijuana in the mother's system at the time of birth?
That's a good question. I believe no, because there's all kinds of different, that stuff's really, really gravy right now. So, you know, I wouldn't comment on that because I don't know the answer to that. I think not, but I don't know for sure. So don't quote me on that. Well,
They say the marijuana today has changed so drastically from back in the 70s. That the TNC and all the stuff that they use in them is phenomenal.
yeah, there's definitely different, I mean, there's a lot of chemical stuff. You know, there's stuff that is sold as marijuana that has other stuff in there. So it's really hard to say unless you see the metabolites. But, yeah. And I have to tell you, again, my heart just goes pitter-patter to see this group of people and to think that this was just sort of a conversation that happened in a basement a few years ago. It's really heartwarming. So again, thank you for all the work you do. It's nice that we can bring people together and you don't feel so alone. And don't ever hesitate to call. You know, if you're a patient of Providence and you have mitra, you can always email me. So that's a really nice thing. That's the best way to get a hold of me. I tell everybody, don't call, just email me. So, but you can't do that unless you're a Providence patient. So, yeah.
Well, thank you, Claire.
Thank you.
Thank you.